Hi, welcome back to my YouTube channel. So today we are going to see an important clinical topic. So why do patients with diabetes mellitus develop cataract? So before going into the actual mechanism of pathogenesis, we'll see some statistics. See, in the United States, almost 11% of the population are diabetic, and they predict that by from 2010 to 2050, number of people with cataracts will double from 24 million to 50 million. So what are the risk factors to develop cataract in a patient with diabetes? So it is common in both type 1 and type 2. And there are few risk factors for cataract and diabetics, which includes younger age, duration of the diabetes, use of insulin, and patients with pre-existing macular edema. So in order to understand this better, we need to know one pathway called polyol pathway, which main purpose of this pathway is to convert glucose to fructose. So glucose enters the cell, will be acted upon by an enzyme called aldose reductase, for which NADPH is a co-substrate which converts glucose to sorbitol. And this sorbitol will be acted upon by the next enzyme called sorbitol dehydrogenase to form fructose. So ultimately glucose gets converted to fructose. What is the physiological significance of this pathway? This pathway is mainly seen in seminal vesicles because the spermatozoa, the principal energy source is fructose. So even if you don't take enough fructose in your diet, your body can still synthesize fructose from glucose using this pathway. However, there is a catch in this. The second enzyme which I told you, that is called sorbitol dehydrogenase, is absent in lens, retina, kidney and nerves. So these tissues do not have this enzyme. So what about it? See, if a patient is having diabetes for a long time, so the main characteristic feature of patients with diabetes is hyperglycemia. So increased levels of glucose in the blood will enter into a lens cell. Increased levels of glucose will be converted to sorbitol by an enzyme called aldose reductase, and this sorbitol will be converted to fructose normally, but in the lens this enzyme is absent. Sorbitol dehydrogenase is absent, so increased levels of glucose will go into the cell, everything will get converted to sorbitol, but sorbitol will not be getting converted to fructose. So there will be accumulation of sorbitol in the lens, and second, there will be depletion of NADPH in the cell. So these two things are main reason for cataract. How the sorbitol is osmotically active, so it draws water from outside into the cell, into the lens cell, so the lens will swell and cause an osmotic damage. So the lens will lose its transparency and will become opaque. So that is cataract. Second, depletion of NADPH can promote oxidative stress that can also lead to damage of the lens cells that can again lead to cataract. So these are the two important reasons why patients with diabetes develop cataract. One's because of the accumulation of sorbitol in the lens, the other because of the oxidative stress because of the depletion of NADPH. So to conclude, there are many types of cataracts in diabetics, many types of cataracts. However, in diabetes, these are the three common types. It can be posterior subcapsular, cortical, and very rarely snowflake cataract. So to conclude, hyperglycemia-induced sorbitol production is responsible for not only cataract but also for other complications such as neuropathy, nephropathy, and retinopathy. Then there are some drugs which can be used to target this enzyme called aldose reductase. One such drug is called apalristat. So finally, achieving good glycemic control and controlling for risk factors reduces the risk of cataract. Thank you.